Was forced to resign amid allegations of sexual harassment, which were investigated by the state attorney general and substantiated tremendously. But his administration, at that point when he was accused, had already lost credibility for something else, lost credibility over the pandemic, masking the number of nursing home deaths. How do you repair the state's credibility after that?
Well, I can do this, and simply it's about being more transparent, releasing the data as we get it, and also not releasing one set of nursing home deaths. There are presumed and confirmed deaths. People should know both. Also, as of yesterday, we're using CDC numbers, which will be consistent. And so there's no opportunity for us to mask those numbers, nor do I want to mask those numbers. The public deserves a clear, honest picture of what's happening. And that's, whether it's good or bad, they need to know the truth. And that's how we restore confidence, when they know that I will always be truthful and very transparent in my approach to government, and not just with respect to nursing homes, every aspect of government. That's been what I've done for 27 years of elective office. It's not a new concept to me.
Do you consider it vital at this moment that the public does get the bad news because you're trying to persuade them to deal with a worsening situation right now?
They need to know I have their backs and I'll do what I believe is in their best interest, but they'll know what I'm doing every step of the way. There's going to be no drama, no surprises from my administration. There's not going to be a situation where information is revealed about a new policy before I've already had a chance to seek out input from everyone affected by it. Now, that'll never delay my decisions. I gather people quickly, I assess, I listen to experts, and then I'm decisive. And that's what the public deserves to hear.
Widely known amongst my subs that sometimes when my subs get pissed off, overly pissed off about a subject, I sometimes give them more. Okay, and this is the case with COVID. I thought I was winding down on COVID because I had done like a year and a half, and just when I thought it was out, they pulled me back in. Okay, this comes from the good doctor, Dr. Johnson, that sent me this. Because when we talk, and I love talking to my wise academic, Dr. Johnson. I feel smarter every time I have a conversation with him. I always say that I do believe that they were hiding deaths in states because they wanted to keep the death toll down. Because even the New York Times, a long time ago, the New York Times and The Economist in London said that the numbers of deaths that they were reporting by the CDC didn't match the numbers of deaths that they were seeing. In other words, they had 25% excess deaths in the United States, especially in 2020, versus the COVID numbers. And when I say excess deaths, they had 25% more than average. In other words, they had like a 30-year average, and you have this big bump right when COVID starts, and you have all these deaths that are unaccounted for that don't make sense. And this is in, I think, the United States. The New York Times did all 50 states. And I think the Economist did 50 countries, and you can see the bump. So this has been around for quite a while. If I find a chart, I think I do have it somewhere. I'll actually show it to you what an excess death chart looks like. But in the meantime, he sent me this. New New York governor adds 12,000 deaths to publicized COVID tally, and this was yesterday. Delivering another blow to what's left of former Governor Andrew Cuomo's legacy, New York's new governor acknowledged on her first day in office that the state has had nearly 12,000 more deaths from COVID-19 than Cuomo told the public. The public deserves a clear, honest picture of what's happening, and that's whether it's good or bad. They need to know the truth, and that's how we restore confidence, Governor Kathy Hochul said on NPR. In its first daily update on the outbreak Tuesday evening, Hochul's office reported that nearly 55,400 people have died of the coronavirus in New York based on a death certificate data submitted to the Centers for Disease Control and Prevention. That's up from about 43,400 that Cuomo reported to the public as of Monday, his last day in office. The Democrat, who was once widely acclaimed for his leadership during the COVID-19 outbreak, resigned in the face of an impeachment drive after being accused of sexually harassing at least 11 women, allegations he disputed. The higher number is not entirely new. Federal health officials and some academic institutions tracking COVID-19 deaths in the U.S. have been using the higher tally for many months because of known gaps in the data Cuomo had been choosing to publicize. But Hochul, who was lieutenant governor before being propelled to the state's highest office, said it was vital to be fully transparent about the numbers. There's a lot of things that weren't happening, and I'm going to make them happen, Hochul said Wednesday on MSNBC. Transparency will be the hallmark of my administration. The Associated Press first reported in July on the large discrepancy between figures publicized by the Cuomo administration and numbers the state was reporting to the CDC. The count used by Cuomo in his news media briefings and on the state's COVID-19 fatality tracker included only laboratory-confirmed COVID-19 deaths reported through a state system that collects data from hospitals, nursing homes, and adult care facilities. That meant the tally excluded people who had died at home, in hospice, in prisons, or at state-run homes for people with disabilities. It also included people who doctors believed died of COVID-19 but never got a positive test to confirm the diagnosis. Such tests were scarce in the initial months of the pandemic when hundreds of New Yorkers were dying each day. There are presumed and confirmed deaths. People should know both, Hochul said. Cuomo spokesperson Rich Azzopardi said the former administration had only been reporting clearly labeled confirmed COVID deaths to ensure accuracy, but had been fulfilling its obligation to report presumed deaths to the CDC. New York always reported these numbers and they were always publicly available, Azzopardi said. He didn't address why the state had chosen not to add deaths outside hospitals and nursing homes. By Wednesday, the state's website included the higher tally. Under the Cuomo administration, the state health department refused to make an expert available to the AP to explain its continued decision to publicize only the lower tally. During the spring of 2020, when New York was the deadliest hotspot in the U.S., Cuomo emerged in the eyes of many Americans as a hero of the pandemic for his daily PowerPoint briefings and stern but reassuring language. He won an international Emmy and wrote a book on leadership in crisis. But Cuomo's critics long charged that he was manipulating coronavirus statistics to burnish his image. Months later, it turned out that his administration had minimized the death toll among nursing home residents by excluding several thousand who had succumbed after being transferred to hospitals. Cuomo used those lower numbers last year to erroneously claim that New York was seeing a much smaller percentage of nursing homes residents dying of COVID-19 than other states. On Wednesday, several lawmakers from both parties called on Hochul to fire State Health Commissioner Howard Zucker. The department did not immediately respond to a request to interview him. Republican State Senator Sue Serino called Hochul's disclosure a welcome step forward on the transparency front and pushed for an investigation of New York's COVID-19 response in nursing homes. In order to rebuild public trust, it will be important that anyone who had a hand in manipulating or withholding relevant data from the public no longer has a place in state government, she said. Senator Gustavo Rivera, a Bronx Democrat who chairs the Senate Health Committee, was among those calling for Zucker's removal, saying he aided and abetted the worst times of the pandemic, what is obviously the governor's efforts to burnish his image. What you have here is just the clearest evidence, as if we didn't have enough, that this administration went out of its way to make the governor seem much better, much more skilled, and that he had handled the pandemic much better than anyone else, Rivera said. Federal prosecutors have been investigating Cuomo's administration's handling of the nursing home data. The State Assembly Judiciary Committee has also been investigating the matter. This week, in the wake of the sexual harassment scandal, Cuomo's Emmy was rescinded, and the publisher of his book has said it will no longer hardcover copies, and it will not come out with a paperback edition. Wow. I guess you get canceled. But New York is not the only one that's hiding its data. Florida is also has been suppressing its data. That's how come that, I can't remember her name, but she was actually keeping an accurate count outside of the official count of Florida's deaths. And they actually put her in jail for, I think, a few weeks and took her computers because the governor didn't like that she was embarrassing him, because DeSantis needs to keep a low count. They need to keep a low COVID count of COVID deaths. Texas, Georgia, and there's a couple others. I think might have been Oklahoma, or I think it might have been Oklahoma or Tennessee. I can't remember which one. Are actually keeping low counts. A lot of your red states were undercounting the deaths, which is not amazing because everybody thinks it's a conservative thing or a capitalist thing or whatever. But the thing is, China's doing the exact same thing. China's death rate for COVID-19 since their bump in early 2020 has been virtually zero, which is impossible, especially when that, for Korea, who has like 1/10 of its population, maybe less than that, has way more numbers, way more dead, way more sick, and they're right next door. So their count is virtually impossible, and Hong Kong still won't let people across to visit. So people think that states and countries are actually inflating the numbers. I said they're doing the exact opposite. I've been saying they've been doing the exact opposite for a very long time. And this is just one more piece of evidence that they're not inflating their numbers. They're actually deflating their numbers. Man, I get the COVID deniers and the anti-vaxxers and stuff like that. It's funny, the anti-vaxxers can make up numbers just out of willy-nilly and pull their numbers out of thin air about people dying and people being dead. The thing is, when people are actually dead, they're actually in hospitals. They're actually dying. They actually keep account of them. But they want to downplay those, but they want to make up numbers that are in their favor, which is actually silly to me. And I've been saying this for months. I've actually been saying this for over a year, that the numbers are being depressed. Trump was doing it. Other conservative governors were doing it. And Cuomo was not a conservative governor. Cuomo was actually a Democrat. Cuomo's a liberal Democrat. He was doing it. So I believe every state is actually depressing the numbers so that they don't look as bad, including California. Because the first thing I get is they're padding numbers. They're trying to get extra money. They're trying to look good amongst the CDC. And they think that, and I've been telling people that they're so strict that the CDC and everybody else is basically, when they count numbers, especially COVID-19, they're really strict about having a test, a confirmed test for COVID-19 numbers. And exactly what I was saying is actually true, because that's exactly what she just said, that Cuomo was doing. They were going by confirmed test and not by presentation of symptoms, because the flu, 90% of flu cases are presentation of symptoms. Has nothing to do with a confirmed test. But everybody accepts that if somebody dies of the flu or somebody dies of flu-like symptoms, then the presentation is enough. You don't need a test. They've been doing that for the flu for ages. With COVID-19, since nobody likes the Wuhan virus, or the woo-woo as they say, so everybody wants to get really particular and really persnickety about counting COVID deaths and counting COVID cases, and we want to microscopically challenge every little bit, even though the pattern is the pattern. Pattern is a pattern. You can say what you want, but the pattern is a pattern. In year two, I've been looking at this for a year and a half, and basically you can almost predict when, just by the cases, whether you like the cases or not. And we say that a certain percentage of people will die. That is very true. But the thing is, it doesn't matter about the percentage. Okay? If you see a rise in cases, you're going to see a rise in hospitalizations. You're going to see a rise in deaths. That has been spot on for a year and a half. That pattern has not broken. And the higher the cases, the higher the hospitalizations, the higher the deaths. It is what it is. And hopefully this year we don't break any records. Hopefully they have enough medical knowledge how to treat these people so that they don't die. But even if they don't die, a lot of people are going to get damaged by this COVID-19 virus. Because most people, when they catch the flu, it doesn't take them 4, 5, 6 months to get over it. I know people that still have effects of the coronavirus damn near a year later. I know people that have long COVID and still are feeling the effects from the long COVID. COVID-19 is nothing to play with. I have told you that from the very beginning. Nicole has told you that from the very beginning. This is not your average bear. This ain't Yogi, okay? This is a full-on grizzly. It might be a full-on polar bear, which is something you would never like to see in the woods. I know you got people that are anti-vaxxers, COVID deniers, all that kind of stuff. This is not the time to freaking play with some shit, okay? This is not the time to talk about conspiracy theories, okay? This is too serious. And all the other conspiracies that you could talk about, that people believe in, that people will bandy about, you know what? I am a conspiracy theorist, and I love a good conspiracy. But the thing is, when I see something that's in front of my face that makes way too much sense, guess what I throw out? It ain't no conspiracy no more. It's fact, because I'm looking at it. A lot of stuff that I told you last year is coming true. A lot of stuff Nicole just told us in a stream that this particular bug is very evasive when it comes to immunity. So how come you see all these freaking breakthroughs with the Delta? Anybody that heard her would have known that there's going to be breakthroughs with Delta. So that means you got to use everything in your arsenal to stay healthy. The reason that this stuff is breaking out, and it's breaking out in broad numbers, is because you opened up the economy. People are back to work. People are back to school. People are refusing to wear masks. Guess what you're going to get? You're going to get an increase in COVID. Guess what you're also going to get come October? An increase in the flu. The flu is going to, I believe, and this is just me, I believe the flu is going to come back with a roar. Because you had a lot of people that didn't have flu last year because they were social distancing. They're washing their hands. They're wearing a mask. Okay, the flu was at bay. A lot of people didn't get that yearly immunity boost because they would have a small case of the flu. I predict the flu is going to be bad this year. Come September, come October, come December, I believe you're going to get one hell of a flu this year. And if you combine that with COVID-19 and people still pretend like this is nothing, it's a walk in the park, hopefully I'm wrong. Now this one, I hope I'm wrong, because if I'm right, you're going to have a hell of a lot of dead people this year. And I hope I'm wrong. This one, mark it down right here that BGS hopes that he is wrong about this. But the thing is, I got a gut feeling. Obi-Wan Kenobi, he always used to say, I got a bad feeling about this. Anywho, that's my daily, I'm going to piss people off today, because I know a lot of people said they had stopped listening to me because the fear porn had got too much. And then guess what? When they needed it, they needed to hear it because the stuff started breaking and happening. They all of a sudden came back. That's, and this is on top of the unemployment being gone, the rent moratorium being gone. You have a lot more people out there in the street, a lot more people homeless, a lot more people desperate. And I believe this, man, I don't even want to see it, man. This is going to be, hopefully this is not a perfect storm. This is going to be a mess. And you better hope like hell that the old man in office is up to handling this stuff, because whatever skill that he has, he's going to need every bit of it to manage this bullshit, man. I'm telling you. Anyway, I'm going to jump off here. This is BGS out. I'll see you guys on the next one.